Did you know that dementia is one of the top 10 causes of death in Canada and one of the fastest growing health crises facing the country?
On average, 350 Canadians are diagnosed with dementia every single day. And that number could actually grow. The big question is, are we prepared? Is Canada prepared? Joining us now to discuss the national call for action for improved dementia care here in Canada is Saskia Sivananthan, founder and CEO of the Brainwell Institute. Welcome back.
Thank you.
Welcome back.
Thanks for having me.
Saskia, for those who are not familiar, can you break down what dementia is and how it impacts patients?
Yeah, so dementia is actually a condition. It's not a disease, and it's an umbrella term. So it's kind of like saying cancer. There are over 100 different types of diseases, and what ties all of them together under that umbrella is progressive memory loss. So Alzheimer's disease is the most common form of dementia. About 60% of the cases are related to that.
Okay, so let's talk about the initial step in dementia care, and that is actually receiving a diagnosis of dementia. And research is showing that patients in Canada, they can wait up to 2 years to receive a proper diagnosis. Why is it that long?
And you know, that's the average. So it can actually be longer. So if you have young onset dementia, the average is 4 years. It really depends on where you are and what kind of access you have. And I think there's a couple of different things, but the biggest piece around dementia and why people don't get the diagnosis is fear. It's stigma, right? It's a mental health condition, and people are afraid to get diagnosed because they don't know what will come next. They feel like there's not a lot of hope, that there's no therapies to support them, and physicians feel the same too. So there are a certain number of doctors who won't provide the diagnosis, even if they know their patients might have early symptoms of dementia, because they don't want to label them, and they feel they can't give them much to support them, even though we know now there are things like rehabilitation therapy, lifestyle changes, and other therapies coming to the market.
Okay, so you mentioned that research around rehabilitation is growing for patients with dementia. So can you share with us what researchers are saying are some of the most effective ways to support them?
I think rehabilitation therapy is probably one of the most underrated forms of therapy, and it's not offered to people living with dementia, but we offer it to other kinds of diseases like stroke and cancer, which are larger conditions that have similar kind of disabilities. And so the frame of reference we have to think about is dementia is a disability. We tend to think end stage, right? We go straight to, that's it, I'm gonna forget everything, people are gonna tell me I can't do things anymore, and we start worrying. But on average, people live 8 years with dementia. So what rehabilitation therapy is, the goal is to help the person to live their life as best as they can, and for whatever their life goals are, functional goals. So I'll give you an example. I'm a pianist as well, and I love to travel. And if I develop dementia, I would still want those to be important goals for myself, right? And so rehabilitation therapy includes occupational therapy, physical therapy, speech therapy, cognitive therapy. If I started accessing those early, I'd be working on my finger strength, my arm strength, my muscle strength, my communication skills, so that I can still play the piano. And I might not be able to remember how to play the same way as I did before, but through cognitive therapy, there could be other ways to do that.
Okay, interesting. So your research says that Canada is innovating, but we're not actually integrating, and our solutions, you say they're stuck at a local level. Break this down for us. So what is happening? How are we innovating? And why is it not funneling through?
Yeah, so we released a report called Mind the Gap, kind of a play on the subway, right? Because there's a gap between these really good programs that have been funded through the National Dementia Strategy, these pilots, and they are not being integrated and accessible to everyday people. So the analogy is a house, right? So these programs are, we've created a side table, we have a blanket, we have a bed frame, but we don't have a home where all of those things can be and where people can access it. And that's where we're getting stuck. We need to integrate in our different health systems at the provincial level so that people can access those.
So you mentioned that there's been over 70 programs funded under our National Dementia Strategy. Give us an example of what these programs provide.
Yeah, I mean, a lot of them go back to rehabilitation, lifestyle changes that can really help people live well with dementia longer. An example is the JERAS program, which combines dancing and cognitive and physical therapy, right? You'd want to be able to access that if you were diagnosed so that you can maintain your physical function for longer. That's an example.
Okay, so what are some of the countries that we can look at who maybe are doing this better than we are and maybe borrow those ideas into our national plan.
Yeah. So the report compared to 12 countries, and spoiler alert, Canada ranks 7th out of the 12, so we're not doing that great. And what we realized is the countries that do things well get really clear. So Denmark is an example. They were very specific about their goals for their country. One of the goals they set is that 80% of people living in Denmark who develop dementia, get a diagnosis, and they get it by 2025. So why is this important? Well, first it means you're getting a very clear diagnosis. So in Canada, we're estimating only about 50% of people actually get their diagnosis. And then if they even get the diagnosis, they're told they have dementia, which is like just saying you have cancer. You're not told what kind of dementia, what can you do about it, how long, what are the treatment options. So Denmark got really specific that way.
Go ahead.
Well, one more quick example is Germany. And what they did is they were very clear about roles and responsibilities. So they really made the whole country work as a team. They had like the Alzheimer's societies participate in the strategy, and they had specific roles. They got the Ministry of Education and the Ministry of Health to work together so that everyone kind of knew what they were supposed to do, when and how, and made it part of a collaborative effort. Whereas, unfortunately, with our strategy, we're not really clear on who's doing what anymore.
I got to quickly sneak this in, but we know that there is a healthcare crisis in this country. It was exacerbated during the pandemic. It feels like it's not getting much better. We have a rapidly aging population in this country. So where does the dementia care, or maybe lack thereof, where does that map onto our current healthcare crisis? Like, are a lot of people going to fall through the cracks? And what's that going to result in?
Yeah, I mean, a lot of it is being driven by older adults and people living with dementia. Like right now, if you look at the hospital wait times, 50% of alternate level care hospital beds are people living with dementia who are in those beds waiting to get access either to long-term care or programs and supports. And that's driving it because that's urgent care. That's not where people should be. People living with dementia should be getting care in the community, right? And when you look at it across all 13 of our provinces and territories, we don't have dementia care pathways. We don't have any centralized way to access things, but we do for stroke and cancer.
Okay, we have about a minute left. So I understand that you have a friend, Phyllis, who was diagnosed with early onset dementia at the age of 48. And she told you that people living with dementia really need a little bit of extra love. Can you expand on that for us?
Yeah, I love that acronym. And I think Phyllis is probably the embodiment of love. So what love stands for is listening, understanding, validating, and empowering. And her point is that when you get a diagnosis of dementia, it feels like your world is turned around and people start telling you, you cannot do these things, you can't make decisions, and family members start taking over. It's well-intentioned, but actually not empowering the person. It's not supporting them to live as well as they can with dementia. So we all need a bit of love in how we work with each other.
Yeah, an implementation of these programs. Absolutely. Saskia, thank you.
My pleasure.
Thank you.
Thank you for having me.
Hey, you, come a bit closer. We've got so many more must-see interviews, spicy debates, lifestyle tips, and pop culture moments. So subscribe to our channel by tapping the logo below and don't miss out.